I'm going to talk here just for 15 minutes about gout, the most common recurrent type of arthritis. The learning objectives from the biochemistry section of the curricular guide indicate that it's important for us all to be able to explain the etiology and manifestations of both hyperuricemia and gout. We should have an understanding of how to manage gout, both by manipulating the diet, implementing some lifestyle changes, and also be familiar with some of the drugs that are used to manage gout. Probably top of the list in our biochemistry class is an understanding of some of the enzymes that are either not produced or inappropriately controlled that result in hyperuricemia and gout. And of course we should be familiar with one of those diseases that I like to talk about that are particularly uncommon. Lesch-Nyhan syndrome seems to be very, very popular with those people who write board questions. In terms of background and causes and etiology, well, gout, and again, I'm not going to read these slides for you. You can pause the slides, read the slides, and just have a solid understanding of how, in our discussion of gout, in this short presentation, just have a solid understanding of how the areas of physiology, anatomy, histology, pathology, pharmacology, how all of these basic sciences come into play when describing the etiology of gout. So a really common recurrent type of joint problems. The joints of the extremities tend to be hot to the touch and swollen because of the accumulation of uric acid in these joints. And again, it's very common in the peripheral joints, the joints of the fingers, the toes. Sometimes more than one joint is affected. Classically, gout is affecting men of higher socioeconomic status. It's common in Western countries, but becoming more and more common in Southeast Asia. Gout is really caused by one of two different types of etiology, either an overproduction of uric acid or under excretion of uric acid. Individuals suffering from gout, they should avoid purine-rich foods, red meat, creamy sauces, organ meats, and they should stay away from alcohol and liquor and spirits. These should all be avoided. The various stages of gout are shown in this particular slide. The 4 stages of gout, the asymptomatic period, where the clinician should monitor the patient who's hyperuricemic, not showing any overt signs of gout, but certainly some lifestyle modifications may be recommended. With the onset of an acute gouty attack, oftentimes at night, colchicine oftentimes is suggested here immediately in managing that acute gouty attack. And then after the acute attack, it goes away. There's an asymptomatic period that can last for a while. And fortunately, we don't get into stage 4 very often because of the advances in medicine. But you can take a close-up of this slide, kind of interesting, outlining the various stages of gout. The asymptomatic period is shown on the left-hand side of this slide. It's a slide that I took from an article I read recently describing hyperuricemia and gout, the asymptomatic period on the left and the symptomatic disease on the right. You can see that these are key checkpoints in gout pathogenesis, representing the various clinical stages. Stage A on the right is those individuals who are probably hyperuricemic, but without the crystals being deposited. And here here in these individuals, dietary management is kind of recommended here, and lifestyle changes. The monosodium urate crystals become deposited in stage B, and then we've got the gouty flares in individuals who are having multiple attacks in stage C. The chronic advanced gout, stage D, requires specialized interventions, and we see that in this particular slide. So hyperuricemia is the presence of elevated levels of uric acid in the circulation. Nominally, this would be above 7 milligrams per deciliter, but as you see at the bottom of this slide, there's a reference range. Uric acid is very, very insoluble in aqueous environments, and so tends to precipitate once it gets towards the higher end of this reference range. A couple of things are interesting on this particular slide, and I ask you to read through this. Very often we see elevated uric acid levels in individuals who are overweight, or individuals who are experiencing radiation therapy as cells are killed in the radiation therapy. We know there's a variety of drugs that predispose to hyperuricemia, including diuretics and beta blockers. Oftentimes we see hyperuricemia in individuals who are at increased risk of cardiovascular disease and renal problems. So it's important for the clinician, when they're managing these comorbidities, that they should use drugs like the statins for cholesterol, right, that actually reduce uric acid levels, and this is important. So hyperuricemia, elevated levels of uric acid in the circulation, can occur for two reasons, and I'll leave you with this slide. Hyperuricemia can occur as a consequence of overproduction of uric acid or under-excretion. And as you can see here, most individuals with gout are under-excretors, although it's not uncommon for both conditions to be prevalent. The gold standard for gout diagnosis is the joint aspiration and microscopic analysis of the crystals, although CT scanning and ultrasound is becoming more and more popular. The pathogenesis of gout is really the pathogenesis of an inflammatory response. And you can see from this schematic here that the body is responding with an inflammatory response to target the monosodium urate crystals. And you can see this response here. The macrophages, the leukocytes, the mast cells are mounting this response, trying to degrade the monosodium urate crystals. Free radicals are being produced and lysosomal enzymes are being produced in response to the presence of these crystals, which the body actually doesn't degrade very successfully. But we do have this acute inflammatory response, which results in the affected joints being hot and inflamed. When we're managing the gout patient, lifestyle modification is super important. There are some foods that we should eat, some that we should avoid. Generally, hypocaloric diets for the overweight are beneficial. And there's a variety of drugs that the clinician has at their disposal, and we can see a couple outlined on this particular slide. Of course, I'm partial to allopurinol because it's an inhibitor of xanthine oxidase, remember? Febuxostat also a xanthine oxidase inhibitor, but that's non-competitive. So the clinician is trying to manage gout, trying to reduce the uric acid levels to predetermined goals, and really the clinician should be on the top of her game, trying to continue to stay on top of uric acid levels. Finishing up with a look at some of these enzymes that are important in the overproduction of uric acid. You see uric acid or urate at the bottom here. We've got the the pathway of purine nucleotide biosynthesis to AMP. We see the salvage enzymes on either side, important for us to know, particularly hypoxanthine guanine phosphoribosyltransferase transferase, which is defective in Lesch-Nyhan syndrome. Here we've got the salvage enzymes, hypoxanthine guanine phosphoribosyltransferase transferase being significant. Remember, if we add a sugar phosphate to a base, we end up with a nucleotide, okay? And these purine salvage pathways are preferred, making new nucleotides for DNA and RNA synthesis. Remember, if the hypoxanthine guanine phosphoribosyltransferase transferase is defective, we don't salvage these nitrogenous bases and they're converted to uric acid, a problem. If PRPP synthasase is overactive or it's not controlled, overproduction of uric acid, a problem. If glucose 6-phosphatase activity is reduced, then that glucose 6-phosphate is funneled into the pentose phosphate pathway, leading to an increase in pentose phosphate pathway activity and ultimately an overformation of uric acid. Lesch-Nyhan syndrome, I'm going to leave you with these slides. Please do read these slides. Lesch-Nyhan syndrome is a really serious condition associated with self-mutilation on the part of the patient. It's the only pathology, I think, that requires or may require the implementation of a straitjacket. So we can see some management options here. Here is my summary slide. Do take a look at this summary slide and become familiar with my major points here for your understanding of gout.